Hello and welcome back to the channel. If you're expecting, you know that pregnancy comes with a lot of changes, both exciting and challenging. One important aspect of maintaining overall health during pregnancy is vaginal hygiene. Your body undergoes numerous changes, and keeping your intimate area clean and healthy is crucial for both your well-being and the health of your baby. In today's video, we'll be talking about some essential tips for vaginal hygiene during pregnancy to help you stay fresh, comfortable, and healthy throughout this journey. During pregnancy, hormonal changes are one of the first things you'll notice. Your body experiences an increase in progesterone, which can lead to increased vaginal discharge. This is totally normal and is the body's way of protecting the birth canal from infections. However, this can also make maintaining vaginal hygiene a bit more challenging. With the increase in discharge, it's important to practice good hygiene to prevent irritation, odor, and infections. First and foremost, one of the most important things to remember is to keep the vaginal area clean and dry. Bridget Taylor, a childbirth educator, explains the dynamic of vaginal discharge.
Pregnancy comes with a lot of changes in the body and fun new experiences, one of those being increased vaginal discharge, which can either be alarming or uncomfortable. In this video, we're talking about vaginal discharge, what's normal, what's not, and what you can do to make it more comfortable to deal with. I'm Bridget Tyler, a childbirth educator, birth doula, and mama, and it's my mission to help parents feel confident and knowledgeable about all things pregnancy, birth, and postpartum. So vaginal discharge during pregnancy is called leukorrhea, and pregnant or not, discharge is normal for women because the vagina is self-cleaning, and discharge is the way that it flushes itself out to maintain a healthy environment and pH levels. Healthy discharge should be mostly clear or whitish, sometimes slightly yellow, or depending on where you're at in your pregnancy, sometimes a pinkish or brownish color, which can happen at the beginning of pregnancy and is a result of implantation bleeding, or at the end of pregnancy if your cervix is starting to open and blood vessels are being exposed, which causes either brownish discharge or a tiny bit of bright blood red tinged discharge. If at any point you have significant bleeding that you're concerned about, you should contact your healthcare practitioner right away. However, do keep in mind that up to 25% of women experience spotting or bleeding at some point in their pregnancy. It could very well be a yeast infection, which women are more prone to during pregnancy because of the increase in estrogen that upsets the pH balance of the vagina. Yeast infections usually create an itchy or burning sensation in the vaginal area. Boric acid suppositories are an easy, more natural way to treat yeast infections, and I personally use them in my own pregnancy with the okay from my midwife, but it's important that you check in with your practitioner if you plan on using them. Before pregnancy, a normal amount of vaginal discharge per day is between 2 to 5 milliliters, and during pregnancy, it increases, so don't be alarmed if it feels like your underwear is constantly wet. This is actually a protective measure taken by your body to safeguard your womb and baby. In your early weeks of pregnancy, your cervix develops a thick mucus barrier called the mucus plug, and by 12 weeks of pregnancy, your mucus plug is fully formed. Your mucus plug is one of the reasons for this increased discharge. As you reach the end of your pregnancy, you might have bits of your mucus plug come out, or it might come out all at one time. If you feel like your discharge is more liquid, it could be your amniotic fluid, so that's something that you want to be mindful of and talk to your practitioner about if you are concerned. But vaginal discharge that is milky white or mostly clear, odorless, creamy, or gooey is all very normal and is actually a sign of a healthy vaginal microbiome and good hydration. Dehydration is actually correlated to vaginal dryness and increased risk of infection, so keep drinking your water, mama. Wearing organic cotton panty liners and changing them often, wearing loose clothing, wearing only organic cotton underwear so you're not getting PFAs or pesticides in that vulva vulnerable area, never washing the vagina or vulva with soap or direct water into the vagina, avoiding sugary and processed foods, and instead eating whole, colorful, organic foods and fermented foods like plain Greek yogurt, sauerkraut, kimchi, or cottage cheese, along with taking a probiotic or even using the probiotic as a suppository to place into the vagina, can all really improve the vaginal environment. And these are all good practices to help you avoid GBS in pregnancy as well. I won't go into the specifics of GBS in this video, but basically it's a bacteria that is harmless for mama, but can potentially pose a threat to baby during birth. But we can do a lot to prevent it now and get rid of it if we have it.
Pregnancy can make you sweat more than usual, and that added moisture can contribute to irritation or yeast infections. To prevent this, it's important to gently wash your vulva with warm water and mild, fragrance-free soap. Avoid using strong soaps, feminine hygiene sprays, or douches, as these can disrupt the natural pH balance of your vagina. Your vagina is self-cleaning, so all you need to do is keep the external area clean and allow your body to do the rest. When washing, always be sure to rinse thoroughly and pat dry with a clean towel. This helps to avoid moisture buildup, which can contribute to bacterial growth. You should also wear breathable, cotton underwear during pregnancy. Cotton fabric allows your skin to breathe and reduces the risk of moisture buildup, which can lead to irritation or infections. Tight, synthetic underwear can trap sweat and bacteria, creating a breeding ground for infections like yeast infections or bacterial vaginosis. When selecting underwear, make sure they're comfortable and breathable, and try to avoid wearing thongs or anything too tight, as they can increase friction and irritation in your sensitive areas. Another essential tip for vaginal hygiene during pregnancy is to change your underwear and sanitary products frequently. Pregnancy often means heavier discharge, so it's important to change your underwear at least once a day, or more frequently if necessary, to stay fresh. If you use pads, be sure to change them regularly. Every 4 to 6 hours is ideal, to prevent moisture from accumulating, which can lead to irritation or infection. You may also want to consider wearing panty liners if the discharge is heavier than usual. Just be sure to change them regularly to avoid bacteria buildup. When it comes to managing vaginal hygiene, it's important to stay hydrated during pregnancy. Drinking plenty of water helps flush toxins from your body, maintain healthy skin, and keep your urinary tract functioning properly. Dehydration can lead to dry skin, including in the vaginal area, and it can also increase the risk of urinary tract infections, UTIs, which are more common during pregnancy. Staying hydrated is one of the simplest ways to support your body and promote healthy vaginal hygiene during pregnancy. It's also a good idea to monitor your vaginal discharge and be aware of any changes that might indicate an infection. During pregnancy, it's common to have more discharge than usual, but changes in the color, consistency, or smell can be a sign of an infection. If you notice a thick, white, cottage cheese-like discharge, this could indicate a yeast infection. A foul-smelling discharge, especially if it's green or yellow, could be a sign of bacterial vaginosis. If you experience any unusual symptoms such as itching, burning, discomfort, or an unusual odor, it's essential to see your healthcare provider. They can diagnose the issue and provide safe treatment options during pregnancy. Also, make sure to avoid using any harsh products or chemicals near your vaginal area, especially during pregnancy. This includes scented wipes, sprays, or lotions that may irritate the sensitive skin around the vulva. Fragrances and chemicals in these products can disrupt your natural pH balance and cause irritation, which can increase the risk of infections. Stick to mild, unscented products or just use warm water to clean the area. It's also important to note that while sexual activity during pregnancy is generally safe for most women, you should ensure that both you and your partner are clean before engaging in intercourse. Make sure to urinate before and after sex to reduce the risk of urinary tract infections. Also, make sure to practice safe sex to avoid sexually transmitted infections, STIs, as these can be harmful during pregnancy and can affect the health of your baby. Lastly, make sure to listen to your body. If you ever feel discomfort or notice anything unusual, don't hesitate to reach out to your healthcare provider. They can offer guidance and reassurance, and they'll be able to help you address any concerns you have about your vaginal health during pregnancy. To wrap up, vaginal hygiene during pregnancy is about being gentle and mindful of the changes your body is going through. By practicing good hygiene, staying hydrated, and being aware of your body's signals, you can help ensure a healthy and comfortable pregnancy. And as always, if you ever feel uncertain about any symptoms or changes, don't hesitate to consult your healthcare provider. Thank you so much for watching, and I hope you found this video helpful. If you enjoyed this content, don't forget to like, share, and subscribe to the channel for more tips and advice on women's health. Drop any questions or comments you have below, and I'll be happy to respond. Take care of yourself, and I'll see you in the next video.